Welcome back. Let's discuss red light therapy. The long short on red light, pretty much wherever it's applied, we do see documented benefits, whether it's hair growth, anti-aging to the skin, improved cognition, less joint or muscle pain, reduced autoimmunity, so on and so forth. So this is a therapy that I think is exciting. It's relatively inexpensive and safe, and one I feel you should consider as part of a healthcare plan. The basis for how red light improves health is by increasing the ability of your mitochondria, which every cell of your body is going to have a few hundred to over 1,000 mitochondria per cell. Red light will improve the ability of the mitochondria to make energy. One of the preeminent theories of aging is that energy demands of a cell outstrip energy supply. And so the cell, whether it be hair, skin, what have you, start to exhibit signs of aging. And this is what red light can help to counter. And just to quickly show you two visual pieces of evidence, one study pre-post, this is from a scientific journal, by the way, clearly demonstrates improvements in skin appearance by reducing the signs of aging. And another study found visible improvements in hair growth. Now, this extends beyond just superficial to things like joint, muscle, cognition, sleep, and even energy levels in something like chronic fatigue. What I wanted to do today was go through the common applications and translate the science into a scorecard, grading A, B, or C, so you have a rough approximation of the level of benefit to be gained by utilizing red light therapy. And then we'll conclude with specific device recommendations along with protocols for use. And if you are new here, welcome. I'm Michael Ruscio, a doctor in clinical practice, an adjunct professor, and I also work as a clinical researcher with a few papers published in scientific journals and more in the works. We should spend just a moment on explaining a little further how red light helps to improve energy production. 90 to 95% of our energy comes from the mitochondria. Within the mitochondria, there's a very important energy production center known as the electron transport chain. Now, when this apparatus is functioning correctly, you have this very elegant shunting of electrons down this membrane across from what's known as complex 1 through complex 4. Now, as the electrons are pushed down this membrane, protons are pushed to the outside of this membrane, creating a proton gradient akin to a dam of water that will then shunt the water through a turbine, spinning the turbine, and thus producing either electricity or, as in the mitochondria, spinning a turbine called ATP synthase and thus making ATP or energy. Why this is so relevant, again, is because if the cell, and these cells might make hair tissue, skin tissue, brain tissue, if they can't produce enough energy, they start to exhibit signs of aging. So smaller hair or lack thereof, less collagen in the skin, impaired neurotransmission, so reduced memory or executive function. And again, this is where red light holds promise. Now, part of the reason why this is so salient is because that electron transport chain is amenable to damage. Drinking alcohol, stress, poor sleep, ultra-processed food, lack of nutrition in the diet, infection, inflammation, all of these things create this sort of self-perpetuating aging cycle within our cells, meaning that electron transport chain starts to leak. As electrons leak, two negative things happen. One, those electrons actually damage the apparatus, and then simultaneously, the apparatus is able to produce less energy, or its energy production is inhibited. And with less energy, there's less energy available for repair. Hence, we have this sort of propagation of the aging process. And aging doesn't just mean superficial looks, let's say. It also includes things like joint and muscle recovery and cognition and even perhaps autoimmunity. This brings me to one quote I wanted to share from Nature Review's Endocrinology. Aging and age-related diseases are tightly related to an imbalance in energy supply and energy demand, as we just covered. One point in particular I should make is that the target of red light is a key enzyme within this electron transport chain called cytochrome C oxidase. By targeting this enzyme, what the red light will do is improve shunting of those electrons down the electron transport chain, create a higher gradient or more water on the other side of the dam, thus higher flow through of that ATP synthase, thus increased energy production. From a 2018 review paper, the application of red to infrared light has been reported to alter the course of age decline. These wavelengths are absorbed by cytochrome C oxidase, increasing its activity along with mitochondria, membrane potential, and ATP production. And by the way, if you're new here, please like, comment, or subscribe. This really helps the channel and also allows us to reach and help more people. Okay, so we mentioned a moment ago the impacts on aging. I wanted to provide one comparison looking at red light therapy next to a commonly used skin anti-aging intervention, collagen supplementation. Red light therapy led to a 30% reduction in wrinkles and signs of skin aging, whereas collagen led to a 20% reduction in signs of skin aging and wrinkles. So they're both viable, but just to give you a comparison. And with hair, I found this particularly interesting. So for hair loss, two of the most common therapies used are either minoxidil Rogaine or finasteride, and they both work. But a few interventional trials have compared these three interventions, red light, minoxidil, finasteride, against one another. And they found the largest degree of improvement in hair growth or follicular density, by the way, in both men and women with red light. Pretty exciting. Now, all that being said, as a quick aside, I would recommend using multiple hair or skin interventions together because of none of these alone lead to a drastic improvement. They lead to a visible and a measurable improvement, yes, but I would say from a user perspective, none of these alone are going to make you say, wow. So just my personal perspective there in terms of combining multiple of these to hit a end result where you go looking in the mirror, yeah, my hair, I'm happy with how it looks, my skin, so on and so forth. I mentioned autoimmunity before, and there was one study here that I found just fascinating. Thyroid autoimmunity can cause hypothyroidism. Now, we have a few therapies besides red light that have been well studied in the ability to reduce thyroid autoimmunity. The most common metric here is looking at TPO antibodies, thyroid peroxidase antibodies. The sort of tried and true, if you will, interventions, vitamin D, selenium, and myoinositol, on average, lead to a 200-point reduction in TPO antibodies, which is great. But this one trial, which was very well performed, either administered a fake sham light or a real light, and this is important because it helps reduce the placebo effect. They found a 600-point reduction in TPO antibodies. That's pretty remarkable, simply by putting a red light to the thyroid gland. A few other points from this study, as you would expect, with reduced autoimmunity in the thyroid gland, there was improved thyroid function. Therefore, 48% no longer required their thyroid medication, in this case levothyroxine, while simultaneously ultrasound findings documented improvements in the health of the thyroid tissue. So pretty exciting. We discuss frequently on this show the importance of gut health, and with red light, it's really too early to say. There have been a couple studies in either mouse models or humans finding that red light will improve the balance of healthy bacteria, but nothing going a step further, showing less pain, less bloating, improved bowels, what have you. So we really don't know. I think it's reasonable to try red light applied to the abdomen to see how you do, but there's just a paucity here and it's too early to be able to say. One common application is joint pain. One of the novel things about red light, through in part its mitochondrial impact, is you will experience a suppression of an inflammatory pathway called NF-κB, simultaneously bolstering another pathway called NFR2, which is a nuclear response element, essentially allowing the higher production of key antioxidants like glutathione and superoxide dismutase. One analysis found that red light therapy led to a 20-point reduction in knee pain compared to Advil or non-steroidal anti-inflammatories, leading to a 10-point reduction. So it appears that red light is slightly more effective. And to share a quote here, the positive effects from red light therapy seem to last longer than those of widely recommended painkiller drugs. So pretty interesting. Muscle performance and recovery is another common application, and we can break this down to local red light application, meaning you have a pad that goes over, let's say, a bicep or a quad or a hamstring, or you have a total body panel or a bed. Starting with the local application, small improvements in sort of single muscle endurance have been documented. And as it pertains to recovery and performance more broadly, there's mixed data here. How this breaks down is if you're sedentary and starting to exercise, you can experience improved performance and recovery. If you're an athlete pushing themselves with a very high training load, you can also experience those benefits. But unfortunately, and a little bit sad for me as a normal, regular exerciser, this group of people does not seem to experience improved performance or recovery from local application of red light. Looking at total body application, a large panel or a bed, this quote I found to be interesting. Whole body PBM, so photobiomodulation, another term for red light, may improve sleep quality, but shows no evidence of benefits for exercise recovery or performance. Now, I found this a little bit odd because if we see some signal of benefit for the localized application, why wouldn't we see benefit from a total body panel or a bed? Part of this might be due to limitations in how the studies were performed. Without going too far into the details, but when we did drill down into them, you see that the majority of the studies applying total body red light used a very impressive bed known as the Novo Thor. Now, this bed is $150,000. It's a very expensive and arguably strong, high output device. But if you look more deeply at the methods, the level of irradiance, so how high the settings were turned up essentially, was fairly low. This is measured by units of light per area. It's typically measured in milliwatts per centimeter squared. As context, this behemoth of a bed was applied at a setting of 17 units. But as we'll cover later, you can do a total body panel much cheaper than that bed. And with this total body panel you can do at home, you can hit 280 units of output. Now, maybe this is because as the research in total body bed application was getting started, researchers decided to be more cautious and start at a low setting. But it's because of this that I wonder if we had data using the total body panel or beds at the full setting, would we see benefit? And at current, we don't know. So there's a little bit of a caveat there in the conclusions that total body or bed red light doesn't seem to have an impact on muscle performance and recovery. Now, the total body application, thankfully, did show improvements for sleep. This improvement in sleep has also been documented with a very specific application of a helmet that is designed to penetrate through the skull bone and impact the brain. So either whole body red light or specialized application that gets into the brain have improved sleep. One thing here interesting to ponder is the total body or the bed applications. They will not reach the brain because you need to have a certain pulsing of the red light at either anywhere between 10 and 40 hertz to get through the cranium to have the brain impacts that we see with transcranial red light helmets. But if the bed or the total body applications did not do this, how is it that the beds improve sleep? Well, there's a hint here in the data from one animal study that what may happen when applying red light to the entire body is you improve glymphatic, which is essentially the lymph. So the lymph in the body is one system of detoxification. You also have that lymph in the brain. It's called the glymph. And one animal study did find that shining light on the body improved glymphatic detoxification of the brain, which may improve neurological function, regulating a number of parameters, including sleep. One practice that people engage in is either using a red light lamp or, let's say, putting a red light device kind of in the corner of the room, shining it from afar to have a therapeutic effect. This was studied in the application of sleep, and the researchers did not find that sort of red light lamp or the red light device from afar led to any improvements in sleep. So what this may tell us is to have the improvements in sleep, you need the red light to be close to you and have a fairly high amplitude of output. Okay, so let's discuss fatigue. And in this case, there are some pretty impressive studies looking at fatigue in the context of chronic fatigue syndrome. I want to lead with a quote here. This comes from one clinical trial. The participant commented, "I was able to clean my house from top to bottom. I'm able to wake up and feel more alert, like everything seems more vibrant and easy. I can't remember the last time my pain was this low. My depression was bad, really bad. I was suicidal, but now I don't even feel like that. It's definitely helped with my depression." Now, that's just one quote from one person, but compelling, I think, nonetheless. There have been 3 clinical trials to date documenting as follows: improved fatigue, pain, depression, anxiety, sleep, and I think very noteworthy here, the results lasted 6 months after the red light therapy was discontinued. Now, part of what might be happening here takes us to another mechanism of how red light improves mitochondrial function. We talked about that key enzyme, cytochrome C oxidase. When there is inflammation, it will actually inhibit that cytochrome C oxidase, shutting down this sort of cellular energy production mechanism, or not truly shutting down, but inhibiting. You're never going to have it go to zero. Now, one of the ways inflammation turns down the mitochondria is by having nitric oxide bind to that cytochrome C oxidase. Nitric oxide, you may have heard of, that people use for erectile dysfunction, for cognition, in pre-workout formulas, because nitric oxide improves blood flow to brain, to genitalia, to muscles, hence why it's used in all these applications. However, inflammation will change the function of nitric oxide from what's known as constitutive or normal to inductive. It's that inductive nitric oxide that inhibits mitochondrial function. Inducible nitric oxide does have some merit. It's part of the inflammatory response. However, what happens in a lot of cases, especially in westernized societies, is inflammation becomes chronic and rampant. And this is, again, one of the mechanisms that red light helps to correct. It decouples from that mitochondrial enzyme, cytochrome C oxidase, nitric oxide, allowing the mitochondria to make energy, but also allowing nitric oxide to do what it should do, improving blood flow. And so this might be why people with chronic fatigue syndrome have less depression, as we just covered, and also less muscular pain, because they're restoring blood flow to those areas, because they're decoupling nitric oxide from the cytochrome C oxidase in the mitochondria and allowing it to have the vasodilatory effect, improving blood flow to brain, to muscles, and other places of the body. So this dovetails nicely into how red light therapy, when applied transcranially, can lead to improvements in cognition. When applied transcranially, it's been documented that red light can reduce the activity of these immune cells in the brain called microglia. And by doing so, again, lowers inflammation, but simultaneously, red light has been documented to increase perfusion or blood flow to the brain, which in light of everything we just covered would make sense. If inflammation simultaneously disrupts blood flow, then if the if the red light is targeting the cytochrome C oxidase, and that's freeing up the nitric oxide, you both have a reduced inflammatory response while simultaneously having better blood flow, in this case, better blood flow to brain. And this is probably why we see transcranial red light, so these helmet devices essentially, lead to improvements in both healthy and diseased populations. So in healthy adults, improvements have been documented regarding memory, attention, and executive function or decision-making. And in disease states, improvements documented in mild cognitive impairment, in dementia, in traumatic brain injury, stroke, Parkinson's, and autism. Pretty impressive. Quoting another research paper here, the results suggest that TPBM, transcranial photobiomodulation, may enhance brain functions of healthy adults and remediate cognitive dysfunction of adults with cognitive disorders, including learning and memory, attention, executive function, and language. There's an emerging application here for improving brain health, which I think is so crucial. Any clinician who's talking with patients on a regular basis is probably seeing a number of neurodegenerative symptoms: poor sleep, poor memory, brain fog, and alterations of mood. Not to say red light is the only therapeutic approach, but I think the transcranial red light presents a very key opportunity to synergize with whatever the other interventions